Welcome to Rewrite the Mother Code, the show where we can explore our inner mothers to actualize our greatest selves. Through interviews with incredible guests, live coaching sessions, and my own experiences, we're going to dive deep into embracing feminine values and reparenting ourselves. So be prepared to show up, hold space, and be mothered in a way that you never have before, but have always needed. It's time to rewrite the mother code. Hi, and welcome to this week's episode of Rewrite the Mother Code with me, your host, Dr. Gertrude Lyons. I have on the show today a woman, Ann-Preston Bosher, and I'm so excited to have you hear about her. And her business is called Hyphenate Coaching, and you'll get to learn like where that name came from and what that means, which I think in itself is really cool. But how she's on her own mothering journey and ways that she's worked to kind of claim mother for herself prior to having, or, you know, if she does choose at some point to have biological children. But these just beautiful, awesome ways she's mothering in the world and bringing a lot of that to bear, and also wanting to make changes just like I do, you know, in how we talk about it and what it means and how we can come together in that space. So can't wait for you to hear. And also just love being, you know, with someone who gets how important it is to, as when she decided to also add coaching to her, you know, doctorate in physical therapy, that, you know, we're not just physical beings, we're emotional beings that think. And her seeing those connections and understanding that working on herself is going to have an impact on her patients, working on herself and then advancing herself in that way so that she can literally, you know, support and understand that, you know, her doing her own work supports the work that other people need to do in their lives and the ripple effects of that. So I love that recognition. And I love it when I get to be with, you know, people, men, women, when they have that discovery and realize like, oh, you know, I don't need to get coaching because I'm broken. I want to get coaching and elevate myself in my self-awareness, in my authenticity, in, you know, who I'm meant to and how I'm meant to live this life and what's possible for me, and what a gift that is. So I think you all know I love doing that with my coachees, and happy to hop on a call and do any kind of discovery if that's even an inkling for you. So without further ado, let's go meet Ann-Preston. Well, here we are. I am super excited to welcome Ann-Preston Bosher. And thanks so much for being here.
Sure. Thank you so much for having me.
We were just chatting before we got officially recording here and making this connection, because Ann and I both went to the same university for our graduate degrees at the Wright Graduate University. And Ann has her coaching certification from their transformational leadership coaching certification, and is also ACC, International Coach Federation, ACC certified. So that was a huge big deal. We're going to hear more about that, but just wanted to make that connection that we have the same alma mater from that perspective. So I'm so happy to have you.
Thank you so much.
Yeah. And I'm excited to have everybody hear your journey and, you know, what's been going on with you, particularly kind of the pandemic and where you were headed, like as the pandemic started. But you have a coaching practice as well as a pediatric physical therapist practice. And we get to talk about how those go together, what led you to add the coaching to that. And it's really beautiful story that you're living, have lived, and are currently living. So this is, I think, gonna, you know, reveal like how, and I know we're going to get into this, like all the different ways we mother, right? And ways that we want to bring our caring to the forefront and share ourselves and bring healing for ourselves and the planet, you know, in this way. So I'm really grateful for the work that you're doing. So thank you.
Yeah, thank you.
So if you don't mind, I'm going to leave it a little bit general so you can kind of pick up wherever you want in your journey. But I'd love to have people hear what you're doing now and then how you got to be doing what you're doing now.
Sure. So WGU is actually my second attempt at grad school. I graduated from St. Louis University with a doctorate of physical therapy degree in 2011 and started practicing as a pediatric physical therapist. And I've spent most of my career providing services in families' homes through the early intervention program, which is it's a unique practice setting. I think any physical therapist would agree. It's a much more intimate environment. We develop much closer relationships with our patients and their family members, even extended family members. And we also stare down the social determinants of health every single day. So after about practicing for like over 10 years, I started to really sort of expand the lens through which I was practicing. And I started to observe and kind of witness more than just my patients' gross motor skills. Just really started to look at the family system and how trauma was playing a role within the system. That led me to wanting to get a little bit more support and skill in navigating that trauma, engaging that trauma, so that I could be a better support for my patients and their families. And that's when I enrolled in WGU with the intention of getting a certificate in emotional intelligence, as well as transformational coaching. And so the other part of that was I was also on my own like personal journey and just doing a lot of shadow work and growth work. I ended a 14-year relationship when I was 28 years old. And so was just sort of on this journey for myself. And part of the experience at WGU is also engaging in this program called the Year of More, which is designed to help your own personal and professional growth.
Yeah. And I'm sure that brought a lot to the surface for you. So I love that you saw, because it's easy, I think, as a practitioner to get focused in your arena, right? Like I'm in this setting, with a family, and my job is to, tend to this child for, I'm sure there's a myriad of reasons that you're in there, but something stirred in you to like, I love how you say that. I like lifted my head up and started looking around, at what was going on and saw a lot of dynamics. Right. And what was that like to first, like, what did you feel when you first started noticing that and saw that it's more than about, this isn't the word you would use, fix this child, right? Like get like this child better. There's more going on here that I would imagine you realize adds to the healing or adds to, the whole circumstance possibly.
Yeah. And it's actually interesting that you use the words fix this child, because that was sort of one of the ways that I noticed that trauma was manifesting.
Yeah.
And most of my patients, especially previously when I was working in the Chicagoland area, were birth to 3. Most were under the age of 3. Many of them were born extremely prematurely and were discharged home after many months in the neonatal intensive care unit. And because of that, carry a lot of risks for developmental delays, cerebral palsy, and other medical conditions as well. So one of the things that I was noticing was just how this trauma, this unresolved trauma, because these mothers were, the pregnancy was traumatic, the delivery was traumatic, the post-delivery hospital stay was traumatic for the parent, but also for the baby. Wow. That's one of the things that in our practice, we don't necessarily recognize. And we don't necessarily see that as an influencing factor in children's health and how they respond to treatment and how they respond to therapies and sort of influencing their developmental progression. So I started to notice that because we weren't talking about this trauma, and I think one of the things that we do a terrible job of doing is identifying the loss that these parents and families are experiencing in caring for a child who has survived. Yeah. And we don't necessarily know what that life is going to look like. So there's a lot of uncertainty, but there is still so much loss in that, because the vision of your pregnancy is that it's going to be 40 weeks and that you're going to deliver a baby vaginally, maybe by cesarean section. You'll be in the hospital for a day or 2 and you're going to take your baby home. Mm-hmm. And that's not what these families are experiencing. Right. And so despite having a child who has survived, there's so much loss in the vision that they had developed for their pregnancy, delivery, and their transition home from the hospital and what those early months were going to look like. And then, of course, the vision of their child's future as being a typically developing child. And, will my child walk? Will my child talk? Will my child get married? Can they go to college? I once had a family talk to me about just wanting her child to be able to walk however he was going to walk so that he could get out of his car. And it was just this really interesting moment for me because this was a baby. So I had not gotten to driving a car, but that was where she was. Right. Was that she wants her child to be able to drive a car because that's a part of independence and that autonomy. So one of the ways that I was noticing that trauma was manifesting was this sort of fix it mentality. Like, what can we do? How can I fix this? How can I sort of fight the diagnosis of cerebral palsy, or how can I fix it once we get the diagnosis? And what resources can we use? And then just starting to seek a lot of therapy, which has a lot of impact, right? Because that's a time investment. It's a monetary investment that can impact siblings if siblings are, present in the family system as well. So I think your initial question was, what was I seeing and how is that making me feel? I almost felt like helpless, right? Like I was there to help and I was able to help, but I just felt like the services that I was able to provide were limited and not nearly touching the surface of what we really needed to address around acceptance and, finding a balance in how much is enough for our family and what's too much for our family. What can we handle and what's just going to throw us over the edge? So it made me feel like I was helpless in this position when I was supposed to be helpful. Yeah.
That's what led you to want to be more helpful. Right. And realize like, oh, if I gain some skills here, maybe I can expand my reach in penetrating this family or the situation and provide even more. So that leads me to, you have coaching, you're the pediatric physical therapist and the name of so why don't you share the name of your company and like how you got to that, because it tells us how we're linking these together.
Sure. So the name of my company is Hyphenate Coaching. And when I was coming up, it's so hard, as you know, to kind of come up with a name of this business brand. And yes, you can rebrand and you can rename and all those things, but there's a sense of like permanency to it, right? Like how you're putting yourself out there. And I wanted something that was personal to me, that like reflected me. And one of the most unique things about me is that I have a hyphenated first name. That's right. So it's kind of initially where I went with it. And then the coaching practice is really about connection. And that's what a hyphen does. It connects two things. And so I started to see, okay, I can really play in this space, right? Like the coaching practice, it's connecting the coach with their client, but it's also connecting the client with the person that they're becoming. And then I did a quick search about what the word hyphenate means. And it describes, when it's used as a noun, it describes a person who is active in more than one occupation or sphere. I
never knew that. I think that was like, right. That's so cool. Yeah.
Yeah. So that's how I settled on Hyphenate Coaching.
And it makes so much sense. Like you're active in more than one occupation, but I love how, they're intended. Well, you can tell me, like, I'd love to hear a little bit more how you're kind of bringing the two together. Are they completely kind of separate? Oh, I coach individuals and I do the pediatric, or am I bringing it into the family sphere, or all of the above? Like, what's it been looking like now that I know it's kind of new, but not totally, you bringing these together?
Oh, it feels so new. It feels like it's in its early infancy.
Yes.
So my sort of overarching vision is there's sort of three arms, and I still work full time as a pediatric physical therapist, and I work for a major medical institution. So one of my biggest goals that I'm just doing in terms of showing up as a provider and showing up in my authenticity and my sovereignty and being me as I show up to work, not only like collectively when I'm working with my colleagues, but also when I'm serving my patients directly, is having an influence and using my emotional intelligence and my skills to really sort of move the needle in terms of how we're practicing, how we're collaborating as medical providers, and really looking at how can we communicate better so that we're never going to be able to eliminate trauma, because medicine is a very traumatic space. But how can we mitigate it? How can we identify it? How can we recognize it? And how can we start to engage it? And so that's happening through my work as a pediatric physical therapist. And hopefully I would love to one day work more as like a consultant and start to really bring up these issues and raise them more on the systemic level. I recently gave a presentation. I sit on our DEI committee, so the Diversity, Equity, and Inclusion Committee. And I gave a presentation on emotional intelligence and awareness in the workplace. And I was really impressed by how many people showed up. So, I'm just showing up and saying yes to opportunities and sort of expressing my feelings and ideas around different things and trying to create influence and transformation within the medical system. And then I'm also coaching individual clients, which I love. And that is kind of separate from my work as a pediatric physical therapist, but I do love that space. And I love watching my clients grow and holding a container for their growth. And then one day I would love to work, and I think this is probably going to be more on like a pro bono space, but I'd love to work with families, like mothers and caregivers of children following traumatic pregnancies and deliveries who are at risk for disabilities or have a disability or a medical complexity, and just helping them establish a vision for what they want their future to look like within this new context.
Yeah, that's what I love that. I mean, well, all of it is important. And I love how you're touching on and naming. It's, I'm going to realize this vision, not just in one way, but a number of ways, right? Like, and how being my most authentic self and, working on me and elevating my social emotional intelligence will have a ripple effect. And we just, we know that, and that's going to make a difference. And then wherever I can literally share it, live it, bring people to me and through the coaching and all the different ways. But I do love the idea of you being able to offer both the pediatric physical therapist aspect, so credibility as a doctor in that sphere of like, here are things that you can do to help your child, but here's more of what you can do, right? Like it isn't just
here's
what you thing.
Can do yourself so that you can better help your child.
Exactly. And, I know that you would have had at least touched on some, in your graduate program on, you mentioned family systems at the beginning. And I think that's something that, was really hot for a while, like a long time ago. And this realization, like, oh my God, a family's a system. We all impact each other. And there's no such thing as a problem child or, this or let's fix one person in a system and then everything will be okay. It's like, no, everybody has to look at themselves. And when we do, that's great. And, when we see the impact amongst and how we're contributing, right, to everything. And, I would love to see you break into that space. It's just, my personal vision for you is like, hey, while I'm at it, not only, can I like do this, but what if we were to, I'd love to give you some education and share about family systems so you can better understand the impact and understand that this is a healing for everybody. This is something that we're in this together. And we want, this baby to thrive and with whatever it's specifically acutely dealing with, but we're all healing, right? We're all like little wounded boo-boos, I think. Right. And
absolutely.
And that's, that's a lot of belief busting. It's, this is where Rewrite the Mother Code comes in, right? Because we have models and paradigms, and you've mentioned a few times and, like birth trauma and the medical system being a part of instigating trauma, right? When we're all taught to believe like, no, that's like the safe place. Well, not all, of course that's the intention, but it doesn't mean it always is. And for us to kind of peel back these layers in the veil so we can make, more expanded choices and, really all participate. Like, cause I'm thinking about these families, dealing with something significant like this and the opportunity for all of them to learn and grow and heal in that. And, but our anxiety, of course, as you said, like kind of wants us to just get it over with. Like, let's just fix that and carry on. And then, yeah, and I love that you touched on and just want to name like the healing of, broken dreams and assumptions that we have that this was going to go as planned. And then when it doesn't, I don't think our culture very well supports that loss, like the mourning of it. It's like, okay, well, I'll just jump right in and deal with this current situation versus giving ourselves space to have those feelings. So I love that, you're finding like ways to like get in there and do all this, but not a and, I know it doesn't just happen overnight.
Yeah, no, it's a slow process.
Mm-hmm.
And that's one of the things, like, especially in developing a new business, you have all this excitement and drive and motivation, and you just expect that things are going to happen so quickly. And a lot of these are, I think I often lose sight of all the minutia and the small things that I do on a daily basis that are actually contributing to a sense of change and transformation. And so that's like a deliberate practice that I go through like at night. It's like, okay, what did I do today that maybe didn't feel productive, but was actually very productive? And a lot of that really just, I showed up and I was being myself and I was in my authenticity and in my sovereignty. And so, yeah.
And that matters, and underlining for ourselves how much that matters and that has made a difference, to ourselves personally, but to anyone that's in our sphere and around us and taking part in life with us. Right.
Yeah.
And I think I mentioned this or like kind of dropped it in there also, but I would love to like dig into it a little bit more because I see all this as mothering, right? And you taking on different spheres of what it means, or what it looks like to mother. So what does that mean to you? What does mothering in these spheres or in general look like for you?
Yeah, I think when I think of motherhood, I think a lot, I mean, obviously it's the divine feminine, right? It's a lot of those feminine aspects. It's the nurturing, the nourishment. And I think particularly in my field and where this applies to me is the sense of really reading a child's cues and responding appropriately, but reading their nonverbal cues, reading their stress signs. One of the things that neonates often do to show stress is they open their hands, like it's a stop sign, but a lot of people misread it as, they're waving or they're moving, but it's actually a sign of distress. Same thing with hiccups. Hiccups in babies is often a sign of distress. So being able to really pick up on these nonverbal cues and to help demonstrate that I'm responding to your cues. I'm somebody that's here to serve you, that's here to protect you, that you can trust. And we're going to play and we're going to build skills. And it might be hard, but I'm going to respond to your cues and honor them and respond appropriately. So that we can continue to develop a rapport and a relationship and a secure attachment, because that's ultimately what mothering comes down to, is wanting to create a secure attachment with someone or something. It doesn't necessarily have to be a person, and really being able to then nourish and nurture that thing or that person.
Hi, I'm so excited to share with you my 2024 Spring Equinox Self-Mothering Retreat that's happening this March 2024. And I would love for you not only to consider it, but to attend. But in considering it, hey, just knowing that you would be leaving cold weather, if that's the space that you're in, and coming down to just magnificently beautiful, warm, nourishing place of Zihuatanejo, Mexico. Zihuatanejo meaning land of the goddess women, and coming to really take time for yourself. Okay. And that I am learning more and more isn't just a nice thing to do or something extravagant or something selfish. It's essential. And I really want you to take it seriously, to consider, just think about what would it take for me to go. It's a 5.5-day retreat. Getting from where you are, getting there, landing there, and then being in a space that is all about you. It's all about nourishing you. It's all about tuning into you, using everything around us, the nature, the food, the beautiful people, the rituals, ceremonies. I bring it, we really bring it. And we go deeper and deeper as the days go on, and we release, we let go, we bring in what is nourishing, what is empowering, what is that space of just really divine feminine energy. And we do it in the community of women. It's not for everyone. I will be honest, if the idea of leaving and not making it work, or it's just too hard, not for you. If the idea of, spending that amount of time inwardly focused and going to that level of self-awareness doesn't sound like something you're willing to do or put the time and energy into, then it's not for you. And it's good to know that, right? So this is for people who are serious about what it means to mother themselves, what it means to take time for ourselves, and that gift and what that gift can bring to us. It was originally right after my fall retreat. It filled right up. But now some people, it turns out, are not able to come. So I do have a handful of openings. And if you're listening to this and you're willing to take that step, please reach out to me. We can do a discovery call, or you can put a deposit down. I would love that. And you can do that by going to my website, www.drgertrudelyons.com. Go to events, and there you go. It'll all be there. There's a beautiful page there for you to explore. I look forward to hearing from you and then seeing you on my spring retreat. That's beautiful. I love that. And, everything that you described, is mothering, right? Yeah. And not to generalize it too much. Like there's this bigger, kind of thing we consider called divine feminine. And I like bringing that to light, because I think that's something we've lost in when I make this distinction between mothering and motherhood. Mothering is, to me, that aspect of possibility, that divine feminine that's in all of us, men and women, all across the board, those values, that power, that, and you mentioned nurturing, it's also that like protective mama bear kind of, aspects that we all have in us. And something I very much want to change is this belief that like, no, you're only a mother if you have a child, but that's just one way we can mother. And I'm very insistent that we break, that belief that that's a woman's purpose on this earth, right? Is we're here to give birth to kids and, keep going. And if you don't do that, you're not fulfilling your purpose. And just how much that's been ingrained. And it's still with us, even though we have a little more awareness and openness to it. It's going to take some big unraveling. But I figure that's, why I'm doing what I'm doing. Let's like name it as much as possible. Let's make it more overt and out there that, we all like conceive, create, and give birth to a new business, that you're developing and new aspects of that business. And I love what you said about just interacting with the child and those awarenesses of feeling seen and being seen. Right. And yes, we can do that. Why would we only leave that to an interaction that a woman would have with the child that, she brought into the world or has, in her care, when there's so many places and ways that we can be doing that, and we want to. So I love that that's in your thoughtfulness, as you're doing this, and you're seeing yourself, in this more expanded definition of mothering. So if you want to say more about that, or, how what that journey for you has been like.
Yeah, I think it's something that I've seen internally for a long time. I mean, even just like, I am not a biological mother. I do hope to be one day. Mm-hmm. But my friends have kids and I have really close relationships with them. And I've always felt like a very just sort of mothering has come easy to me, right? Just like being able to be with children and respond to children and play with children and kind of get on their level. I mean, I obviously do it professionally as well. Yeah. It's helpful, but even just personally, that's something that's always been a strength of mine. Something that's just very innate within me. And I think it's relatively new that I've actually given myself permission to see myself as a mother. Yeah. And I actually had a couple of really sort of traumatic events here when I first moved to Nashville. I had an apartment fire. There was a shooting outside of one of my patients' houses, and I was feeling I needed some support. So I did a therapy intensive. And one of the exercises that I was asked to do was I had to create a picture. I had to draw, which I'm very left-brained and not a super talented artist, but the whole point was pulling together both hemispheres of the brain and kind of working on opening up that space. So I drew a flower garden, and in the soil and where, the stems of all the flowers were all of the things like I am statements about the beliefs of who I am and what my truths are. So I am worthy, I am lovable, I am curious, I'm perceptive, I am justice oriented, all these things that describe who I am. And then the flowers themselves were actually my roles. I remember I was, using these pastel paints that my therapist had given me since I don't own any art supplies. And I kept thinking like, I just want to write like I'm a mother, but I was afraid to show that to her because she is a biological mother. And I was afraid that she was going to say or think like, oh no, you're not a mother and you don't know anything about motherhood. Like, unless you've experienced it, you don't know it. Don't even touch this.
Oh.
But I chose to do it because I was like, this is the most supportive space that I can sort of reveal this sense of who I believe myself to be. And she was super accepting, and so she was able to honor that for me and kind of just see that this is a role that I play. It's not just a role that I play as a pediatric physical therapist, but that is a place where I do mother. And I also mother my patients' mothers because they need a lot of mothering and they need a lot of support and nourishment and encouragement. And there are also moments where they mother me, right? I mean, we're all just there mothering each other. And it's just a really beautiful experience. So but it took a lot of reframing in order to allow myself to call myself a mother.
Well, I thank you so much for sharing that. I just want to underline some things and unpack it, but I also just want to, I don't know, breathe a moment and take that in, because you just, to me, exemplify like kind of one, what we're dealing with to claim this more expanded definition or, this space, and two, what's possible when we do. Right. Like that. But, I loved you sharing that, I don't want to offend this woman. Right. Or I don't want to, upset her to claim this, but you did. And she didn't, your worst fears didn't manifest. It doesn't mean someone else might not have a reaction like some people do. They're like, you don't know. I mean, I've had clients and people that have had that, people in their lives have that reaction. And it's why I love it, like coming in to disrupt it. Right. And people are going to have a whole range of reactions, but if we don't disrupt it, to have us like look at it and say, well, we'll never, because one of my like visions around all this is that we find more and more ways to unite as women, and bring our power together, bring our capacities, our insights, rather than being a culture where it's like, okay, well, now you've had a child, so you're a mother and you hang out in this sphere. And I know it goes on because I did it myself, the like judging each other for some of our choices or decisions, or feeling like, oh, I can't relate now, or I'm excluded from some of my friends who have kids now, like a whole array of things that happen. But when we're willing to kind of step in there and claim it and see where we're more alike than different and bring those powers together, like, to me, that's the only way our planet's going to heal and survive.
No, and I agree. It's one of those, it's right. Like you can be the same thing and have the same label, and that can look very different, right? Like,
yes,
I'm a physical therapist, but I treat infants, and some physical therapists treat geriatric patients, or they treat sports injuries and, elite athletes, but we're both still considered physical therapists, and we serve, we have the same role, right? Same degree, same licensure, but what that looks like is very different. And there's space for both.
Yeah, there's space for all of us in it. And I so want us to honor and support each other in our variety of choices, right? And encourage each other. Like I know women who've decided that having children isn't, for them. They've made that choice, and they've done it consciously and really explored and looked at it. And how often people in their life will be like, oh, well, you'll get over that, or it's just because the right guy hasn't come along, so you're, often have to kind of reaffirm it for yourself. Right. And we haven't reached that point where we don't have to justify a choice like that as, not only viable, but important. I think it's important that we all don't feel like that's the path, like that's what we have to do. I remember working with a woman who had built a beautiful business and career and had, was loving her life and enjoying. She had been in relationships. She wasn't in a serious one at that time, but had enjoyed some really wonderful relationships. In the seminar that I was leading, she admitted, she's like, well, but I still don't feel like I'm a woman if I don't do that. Can I really fully call myself a woman if I don't have that experience? And I was just like, it just broke my heart, right? That would still be so powerfully wired. And I understand it, of course, but
Sure. Yeah.
all of these amazing things that she had done and was enjoying, right, and loving, was never going to be enough until she decided it was enough. That was a beautiful choice, for her to make. And, all along the way, I know you said, you hope to have children someday, and that's beautiful too, right? But in the meantime, I'm developing myself. I'm owning my mother self. I'm not waiting, till then.
Yeah.
This other thing I'm doing we'll call a job, I don't know, or something, as opposed to like, nope, or you just might choose another way, an additional way to mother, by having a child.
Absolutely. Yeah. And I feel like in the last couple of years, I have experienced some separateness, from my friends who already have children. And I think that all shifts, right? Like when we're in different seasons of life, we have relationships that are easier to maintain. Being in Nashville, I have a lot of friends that are my age, that are single. We're all very like-minded, and we're in a similar season of life. And it's just a little bit easier to connect and relate. And so I think that there's just like some ebb and flow with that, but it is. And I did have a recent experience with, my closest girlfriends from back home in Chicago. We're on a group chat, and there was a lot of celebration because one of my friends had announced that she was pregnant with her third child, and there was a lot of congratulations, and we were all, excited and kind of responding. And a couple of days later, I had launched my website for my business, and I had posted, something in the chat and asked my friends if they would share it in their communities and their channels. And only one of my friends even responded. And I was devastated because it felt like that was like this moment where I felt so separate, because the birthing and the creation and what I had created wasn't being celebrated in the same way, because it wasn't what we traditionally celebrate women for. And then, of course, another friend delivered her third or her fourth child, actually. And then it was back to this celebration. And it was just tough having my ask and like I was asking, it was kind of a bid for attention and congratulations and, this kind of work. And I don't know the first thing about building a website or a business or a brand or anything like that. And I felt really unseen and really separate because, and that was hard, and of course, I don't think that was intentional, but it did kind of,
but it highlighted like what goes on, right? I'm sure it wasn't conscious, right? Like, we only celebrate these things, but that's what happened, right? And it presented itself as like, okay, like this is where we're at, and do you mind my asking, like, have you said anything?
I haven't.
And I'm not saying you have to, I'm just curious,
No, it's something that I've wanted to get clear and complete. And I think because this is something that I navigate a lot as somebody who has done a lot of work on themselves, a lot of shadow work, a lot of work around consciousness and oneness, and just really recognizing like where we are as a society and as a cultural. And I think sometimes it's really easy to forgive something or like let it go because you understand its origin, and balancing that understanding with also validating my own feelings and experiences is a challenge for me. I think I often like let go of things because I'm like, well, I understand. Society has been sending these messages to us for years, and this is just where we are. And this is opportunity for growth. But in that, and in letting it go without getting clear and complete around it. And I am serving to invalidate my own experiences. So
yeah, and that might be something to explore. It's not, we don't have to do those things, but from the work that you do, that in order to have things change, bringing it to people's awareness is important.
Yeah.
Right. And validating your feelings is
Yeah.
important. So should you
Yeah.
choose to do it, like, the benefit of that would be, and the possibilities, because we need to educate each other. Right.
Yeah.
And
Yeah.
understand. And yeah, it breaks my heart. Like, as I totally understand that the blood, sweat, and tears, the unknownness, there's so many. It's really a lot of what I hope to do in my book is like show these parallels and like just kind of put it out there. Like, look how much doing this is like this, right? Like, I'm writing a book. It's a lot like conceive, creating, and giving birth, minus the physical aspect. The parallels are in the things that you're doing. They're there, and we need to recognize them. Right. Like launching a website, and it's super vulnerable, right? You're putting yourself out there, and we need to celebrate each other. I mean, I think that's just the other thing we want to say. We need to, whether we want to put it all and like link it to mothering or not, the truth is we need to celebrate each other no matter what we're doing. And people need to know that. And they need to not only celebrate the things that we're used to celebrating at this phase, in our lives.
Yeah. I totally agree with that.
I feel like, this like big sister that wants to go tell them, like, you need to know.
Right. Well, this is, of course, an interesting and obvious way that I can show up and mother myself in this, right?
Exactly.
By being honest about how I felt and validating my experiences and nourishing and meeting my own needs and of being seen in this space.
Yeah.
So, yes.
Yeah, exactly. And that's the only way this is all going to happen, right? Is when we are willing to take those risks. So you'll have to follow up with me later and tell me, like, how that goes.
Yeah.
I'll be rooting for you. And these things can be messy, and at the same time, it can also be fine, right? Like our fears of like how people sometimes we think they're going to react don't manifest and sometimes they do, but till we kind of put ourselves out there. And I know, you mentioned doing this program called the Year of More, and that's a lot of what that's about. It's like, here, try this assignment, go do these things and see what happens.
Yeah. Let us know.
Go tell someone how you felt and see if it, what it does and the difference it can make. And always coming back to like, it's you standing in your truth, it's you validating your feelings, no matter how anybody responds. Right. And that's, I think, what's so important. And it's brave.
Yeah.
So
it is brave. It does.
It is brave. It is.
It takes a lot of courage.
It is. It's a beautiful example. So you mentioned, because this is just a hot topic of mine. And so I'm going back to you talking about some of these traumas like happening in a place that you don't think trauma is going to happen, which is a hospital, like, the birth trauma. Is that like, what do you see in that regard? Because I think that's another place we're all kind of in the dark, and just, I have a personal opinion to expand our definition of like how and ways that we can give birth. And we think there's one way and only one safe way to do that. And that's not always the case. And I think we all need to know about that.
Yeah. I mean, I see life-saving procedures are traumatic. Even if they're planned, even if they're expected, it's trauma on your body. Your body is not meant to be cracked open, and your ribs aren't meant to be separated, right? Like these are all these advancements that we have that are life-saving,
right?
But it's physical trauma in your body, and it manifests, and there's emotional trauma that responds to that because there's a fear, right? So if you go into the hospital, there are risks. Delivering a baby is risky. There's a lot of physical trauma, that goes on, and your body does things that it's designed to do, but it's traumatic. It's very, very painful, right? Which is why we've created these other ways of doing it more pain-free, right? So I think that we just miss that, right? Because the hospital is a place of healing. It is a place of healing, but a lot of times the process of healing, you create a lot more, you create trauma in that space. And I think that especially in babies, I think we think that they're too young. They're not able to process this.
Right.
they don't have the cognition, they don't have the experiences. It's just something that they are designed to be resilient, which is very, very true. But they do experience trauma. And one of the things that I notice a lot from our babies that are discharged from the NICU is sometimes they have pretty significant aversions to movement, because when they're very rarely moved, which is intentional. I mean, they obviously do a lot of kangaroo care and things like that, but they are moved very, very carefully. And they do a lot of repositioning to simulate still being in the womb space. And oftentimes when they are moved, it's for something that's painful, or they experience a noxious stimuli. So they associate movement with pain. And that can be very hard to dissolve and to reassociate.
Okay.
So we do a lot of, even in these like really small babies, we do a lot of narrating. We talk to them about what they're going to experience. I'm going to pick you up on the count of 3. 1, 2, 3, up we go. And where we're going to lay down on your back, or we're going to sit, or where we're going to go and what we're going to do. So we can set up these expectations that this is not scary. And even, I mean, especially in the heart of the pandemic, when we started wearing masks in the home, I mean, everyone wearing a mask was associated with a doctor and something that was painful.
Wow.
So that even became, and we would have families say like, can you please take your mask off? Like, they're just scared of you. Like, and we're like, well, we can't, but it's true. They develop these associations very, very quickly because they're protecting themselves. It's a protective response.
Wow. That makes so much sense. And as you were talking about that, like the care that you're taking to respond to the baby in that way, like, here's what I'm going to do. Like, let's like talk this through. Does that happen for the mother too? Like, cause I'm not saying we have to tell it, she's not dealing with it in the exact same way, but like that's such a mothering thing to do for the child, and to recognize that. And then I'm thinking about this mom that's just gone through so much and is dealing with their child in there. Like, who's tending to her? I don't think that's where I saw you come in again.
Yeah. And the answer
doesn't have to be you doing everything, but it's like you and your intention of like, wait, we need to also care for this mama who just is been through a thing. And
and I think that in the hospital, there's often a lot of social work that goes on, but once the families are discharged and they lose all of their support. They lose the team that carried them through this acute trauma. And now they're at home where they don't have a lot of support. And some of their children are still experiencing, acute illness. And, it's not uncommon for me as a physical therapist who's in the field to be exposed to traumatic situations where I'm calling EMS. And I'm by myself because, I'm with a family and possibly a nurse if there's one assigned to the case, but I don't have a team of people that I can just call and say, where's the code team? Where's the people to help? But yeah, there's not a lot of support for the families once they get home.
Yeah. And I'd like that to change also. Right.
Yeah.
I mean, it needs to, like, it all is a ripple effect. Right. And, I love it. It's so important. Well, I think the work that you're doing is important and beautiful, Ann-Preston, and I want more and more people to have access to you and know more. So how would people find you and get to discover these layers and your hyphenated everything?
Yeah. So I am on Instagram as @hyphenate_coaching, and I'm on Facebook as Hyphenate Coaching LLC. And I have a website, which is www.hyphenatecoaching.com. So you can find me there, and you can direct message me, email me, and I'd be happy to respond and connect in any way.
I love that. And I really hope that people do reach out and discover you, because I knew you to a degree, but getting to know you even more now, it's like, I want to know. I want to, know more Ann-Preston myself. That's great. So last question that I ask all my guests is, what does rewrite the mother code mean to you?
I think that rewriting the mother code is all about showing up in your full authenticity and sovereignty and making choices that align with you outside of external influences. And collectively, as we continue to rewrite our own mother codes, I hope that we are able to shift into a space where our definition or label of mothering is expansive and inclusive of all the ways in which we mother.
Hear, hear.
Yeah.
Yes, I love it. Well, thank you. Thanks for being on the show. And I look forward to seeing and following you and seeing how all of this evolves for you and your big vision.
Thank you so much. And thank you for all the work that you do on behalf of all of us.
Yay. Well, we're only going to be able to all do this together doing our pieces, right?
Right. Yeah.
Love it. All right. Well, till next time. Wow. I loved getting to know Ann-Preston in this way. We've known each other peripherally, and I love, how it's a small world and we're all so connected, and she knows great people that I know. And she's who I have to thank for being a part of Women of Tomorrow with Laura Bell Bundy and Shay Carter. She made that connection for me. So I just love where and how we all support each other as women, as people, in doing the important work that we're doing. So I loved getting to know how beautiful the work is that Ann-Preston's doing, in her sphere, working with families and working with children who suffered trauma and need, immediate physical therapy from ages, 0 to 3 mainly. And that, what a tender, beautiful time. And her awareness to see like, wow, I want to do even more here. I want to support these families. I want them to everybody to go on a healing journey here and see what's possible. And huge shout outs to her for that and doing what she needs to do to make that a possibility for herself and then the people that she's serving. And particularly want to underline the very vulnerable piece that she shared around, that just highlighted to me how important it is that we kind of disrupt, bust up, the limited definition of mothering to only mean mothering biological children, because it's just we're so much bigger than that. And that's such a beautiful, cool, miraculous thing that we do and can do. And our bodies are able to do this miracle thing, right? But our consciousness and our possibilities and everything, that we are capable of isn't just that. And we mother in so many beautiful ways. And, for her to share where she was hurt by not having that, acknowledged by her friends when she is mothering his business, and how vulnerable that is and what a big deal it is. And that she's considering, sharing that with her friends, because if we don't educate, kind of disrupt or make aware, we don't have to equate them. We don't have to say, hey, this is the exact same thing, but we do need to be conscious and wake up and be aware of what our fellow humans are doing, and particularly the people close to us, because we really need to support and uplift each other and, break down these limitations and these barriers and walls that we've put up that isolate us and, keep us boxed in and don't allow us to see what's possible when we are honoring each other's choices so fully. So thank you, Ann-Preston, for that. And I look forward to hearing any and all of your comments. Looking forward to hearing from you. And till next time, thanks so much. Thank you so much for choosing yourself and taking the time to listen to this podcast. As always, please rate, review, and subscribe to Rewrite the Mother Code. It helps other people who need this message, aka all women, well, actually everybody, men included, to find it. I'm honored to have you on this journey in mothering yourself. Remember, change is uncomfortable, but it's beautiful, and it starts with us. And if you can't wait until next week's episode, follow me on Instagram and LinkedIn at Dr. Gertrude Lyons, or at my website, drgertrudelyons.com, and sign up for my newsletter. I'll see you next time.